Hello friends, welcome to Healthify with Dr. Niyati. A question has come in the Healthify with Dr. Niyati WhatsApp groups by a mother that her daughter is now pregnant and the doctor has prescribed a number of tests. So whether we should do those tests or not. Now here, I would like to say that in spite of being an Ayurvedic doctor, I have been a family physician for many people, and the said daughter who is now pregnant has been my patient since she is a baby. So naturally her mother brought her to me and I've been their family physician for many years and I advise them from that point of view. But before that, I would like to also tell the Ayurvedic perspective in all this. Charak in Sutrasthan, Charak has written the Charak Samhita, and in the Sutrasthan, in the 30th Adhyay, he has said that I have advised you about all these different kind of diseases and the diagnosis, how you will go about the diagnosis, how you treat the diseases. But this is about diseases that are rampant today. There could be many more diseases later on. There could be many diagnostic procedures later on, and the treatment may also vary. All you have to do is see to it whether it is Vata, Pitta, Kapha, and always have an open mind about different diagnostic features and different ways of treating diseases later on also. Taking this into mind, I advise the mother from a family physician point of view that nowadays, because girls are becoming pregnant a little later in age, it's not that girls were not becoming pregnant early, like in the earlier ages also they used to become pregnant later, but there were two things: that the girls were either more active or it could be their second, third or fourth pregnancy also. But at the age of 30, 32, 35, it is many a times their first pregnancy too. And it has been seen that a drug like Ecosprin needs to be given to the girl so that the blood supply to the placenta is correct and good, and so that the baby's growth is very good. Now even the diagnostic features which are told in the beginning, that whether you need to do all these procedures and all these things, I tell them that if your gynecologist has advised them, then go ahead and do them. Always remember that in today's world there are many different scans, anomaly scans, and different kinds of scans that are done right from 4th week, 5th week of the girl being pregnant, and these are very helpful. So one should give the gynecologist the final word. If she says or he says you need to do it, you need to do it. There is no other second opinion. You could take a second opinion of another gynecologist, also telling them that we have come here only for the second opinion, or very openly ask your own gynecologist that we are a little skeptical about these things. People tell us don't go for these scans and all this. So I would like your honest opinion about this. You could do that. Or like I said, I'm the family physician of many people. You might be having other family physicians too. You could go to them too. Because, for example, I'll give you a small example. When we suppose we've soaked mung beans to be sprouted, and they are to be sprouted to such a level on the second day, but they haven't sprouted. We worry, why is the beans not sprouted? Okay, let me tie it, or let me put a little bit of water, keep them a little bit warmer. The same thing happens when the baby is in the womb of the mother. At a certain age, in 4 weeks, the baby has to grow so much. In 8 weeks, the baby has to grow so much. But if the baby hasn't grown at that stage, then the doctor is worried. There could be genetic defects. There is a 21 chromosomal defect, 22nd. The child is called as a mosaic child. It's born, but it is stillborn. And then there is a 9 months if the mother has born the child in her womb, there is an emotional bonding with the child. It becomes very difficult for the mother later on, and a lot of counseling is required. But if the doctor comes to know this even in the 4th week or the 5th week, then it's good, because the doctor will advise that you have a medical termination of pregnancy, which is very right for the mother also. It's less emotional baggage rather than having the full term pregnancy. So I would advise you mothers, those who have even asked me this question, I'm going to share it in my WhatsApp group also. Your gynecologist and your obstetrician's word is the final word. Follow their instructions to the T. Today, mothers want only 1 or 2 children. These are precious children. Autism is also rising because blood supply and nutrition to the baby is lacking. So when there was only 2 or 3% autism, today it is 41%. We want a good healthy child, so follow your gynecologist's instructions or your obstetrician's instructions to the T. If you want any other guidance, you can always contact me. My number is in the description box. Thank you for watching this episode of Healthy 5 with Dr. Niyati. Always, a pregnant woman has many challenges. Remember that in today's world. In earlier days, not many women were working. So if she's pregnant, if she had swelling on the feet, she could rest. Now, if it's a stressful job, she could have high blood pressure, she could have many other problems. So dealing with all these problems is a very difficult task today. And that is why deal it very positively. Be happy during pregnancy. Even if you have to run about, take it as a form of exercise that your baby is getting good blood supply. And even pre-pregnancy, if you're planning a pregnancy, then try to be active, because that is the best gift that you're going to give to your children. Do tell me how you liked this episode. If you have any comments, then leave them in the comment box. Thank you once again.